Community mental health has got public psychiatrists. Fortunately, not enough, so that when you send the patient in, they usually see the nurse practitioner, whoever's involved, or the allied health people, and very rarely gets escalated up to the psychiatrist. But also, we need to better fund them so they can treat the people in the community and help the GPs treat the people in the community. So it's not just about pay, but it's, as we said, the pay should come as a salaried component from the public hospital, not turning the specialists into private providers in order to stay in the hospital. There is a problem in New South Wales public health. For some reason, it's really badly run. When you become a salaried specialist, everyone gets the same money, whether you're on call and having to come in 4 or 5 times a week or on the weekends, or whether you're on call and don't get called in at all. Everyone gets paid the same, a low rate, and underfunded and under-resourced. So we need to really address the state public system. That's an inquiry in itself. This walkout by the psychiatrist is just, to me, a symptom, and it's about privatisation. It's about the state government reducing its bottom line and its exposure, and it's very dangerous and unhelpful for patients, their families, and the GP. Because really, without the input from these services to the GP can't do their work. They're not as skilled in diagnosis, they're not as skilled in the nuances of some of these strong antipsychotic medications, and they're not approved to give them unless the psychiatrist has done it anyway. So for all these reasons, don't think that's because some of the psychiatrists have come back that things are now settling down. They're actually upgraded to a worse stage of the situation. We need to improve the funding to community health, because that's the middle. That'll take pressure so that they can leave the hospital and be managed by community. That's where they go when they leave the hospital. To get them out of the hospital, which costs thousands of dollars a day and puts pressure on the few specialists, you've got to get them back into the community mental health.
Were you saying in Cyprus it's done better?
Well, in Cyprus, interesting. First of all, this is a village situation, but the psychotic people are treated as part of the family. They're just accepted as quirky. They're supported. They're not laughed at. They're integrated. People shout them a drink at the coffee shop. Yeah. In Cyprus, everyone has access to a GP. I think there's a couple of euro co-payment. Yeah. And same for blood tests. And I think it's only a €5 or something co-payment. You see a specialist. So there's access to specialists. And that's a Western, sort of industrialised country. We can do better here, but because we're in a big city, nobody knows anybody. We talk about getting patients out of psychiatric hospitals, which is a good idea, and the funding would follow them to support them in the community. The problem is the funding is not following them into the community, and they're seen as pariahs in society. They're abnormal, they're freaks, yeah, which is not good for them or their families, not good for their treating doctor, but not good for the community, because then we see all these incidences in the newspapers of all these, how did this happen? Right? Well, it happened basically because they couldn't get access to treatment. So the Minns government is not disagreeing with any of this, but what they're saying is we don't have the money to pay. We don't have the money to pay. Well, that's a political issue. Who we vote for is governments who will find the money to pay for health care. The other thing is we need to improve, so we talked about the hospitals, talked about the middle, now we talk about primary care. We said that 70% or nearly everyone is seen initially by a GP, initially with very mild symptoms, even with serious problems. And what we're seeing now is less and less people going to the GP because of fear of cost. It's, like I said, the $42 rebate is a joke. That's giving the okay for doctors to charge. I'm not sure how it happens because I bulk bill, but I'm assuming doctors are sending in the $42 to the government and taking $50 off the patient's say, which to me is not bulk billing. You can't, bulk billing is give me the $90 and I will write into the government to get my $42 refund, right? I think people just now double pay, and I think double pay is an accepted part of the health system, which is illegal, but the government turns a blind eye. That's my interpretation, but I don't privately charge.
So what's the difference between a gap and double paying?
Double pay is, the gap is the second payment. The
Okay.
$42 the government pays,
Yeah.
the $40 or $50 is the gap, supposed gap.
So they ratchet up. So
Well, whatever they feel
yeah,
like, yeah.
yeah.
If the doctor bulk bills, that means he gets direct money from from the patient doesn't pay anything. Right? But if double dipping means the doctor does that, by doing that he's saying I accept this as a full payment for
As
this
bulk billing,
consultation.
but
It's
you
not
give me
bulk billing.
$50 on top.
But he's getting the patient to pay $50 on top.
Yeah.
That's the illegal bit. But if you're paying $100 to the doctor and then you're getting it back from Medicare,
yeah.
That's bulk billing with
that's
a
not bulk
co-payment.
billing. It's not bulk billing.
Well,
Bulk billing
Oh,
is
yeah,
the
you're
doctor
private
directly
paying,
gets
yeah.
paid from the
you're private paying and
Yeah.
taking the
Yeah,
Medicare
you're private
rebate
paying.
back.
But
So
it
that's-
also means you have to have that $100
Exactly.
in your pocket
Exactly.
to give
So
to the doctor.
Exactly.
the doctors
And that's why doctors are getting around that by
That's right.
saying, just
I'll
give me 50
yeah.
and that's what I'm taking
But
off
sign
you.
here for the bulk
My
billing.
doctor then.
So that becomes double pay to me. That's
So
illegal.
the doctors claim it and the patients believe that they're claiming it as well.
I think the patient understands they're getting that money
But
from
they
the
can't
government.
claim that $50.
Yeah.
That's given to the
That's-
doctor.
yeah.
You don't get any money back on that.
With the specialist, of course, they only get $120 back, and the specialist charges $350,
Yeah.
$400. It becomes much more onerous.
They're millionaires.
Now that's the best scenario. That's the best scenario. The alternatives is bulk billing GP in a medical centre, who's bulk billing you $42, who's only getting 50% from the medical centre. That's $21, right? Yeah, and just pushing people through
That's right.
to try and get as many the fast short taxi trips. Yeah. Now you can imagine the mentally ill in that predicament. Yes, we're getting bulk billed, but who's really taking care of us? Yeah. Added to that is that if you go over 10 or 15 minutes, whatever it is, it becomes $140. It becomes very expensive. And when you go to the doctor, they're telling you you can only have 10 minutes straight up front. So it's a very daunting, unhealthy health system. Now, recently, and on the background of all that is that it's fee for service, which means that if you've come with a mental health problem or a chronic problem, you really want to spend some time with the patient. You want to be billed. You want to charge the government per hour. Much better way. And we are pushing for increased component of salaried payments with the GP because 60% of those visits are chronic, including mental illness. So we're not just pushing for an increased rebate, but obviously we're pushing for better funding for Medicare. Now you understand this is the government recently proposed, I think Albanese, we're going to increase your payment to the GP. Everyone's going to be bulk billed. So what are they proposing? The rebate will stay at $42 and the government will give an incentive of $21 that they're already giving now for children and pensioners to everybody. So they're saying that the doctor will now get $63, which is getting closer to the $85, which will encourage them to bulk bill, right? And if they bulk bill everyone, they'll get another 12.5% on top, say another $10 or $15, takes them to 70. They're getting very close to the 80, yeah? But what you've got to remember in all of this, and Dutton has now come in and matched it by slashing public service and making cuts everywhere else. In other words, making it very obvious to people that you're not going to get this for free. You've got to pay for it. It's quite nasty way he's doing it. So, but what you'd be saying as a reasonable person is, well, if the rebate is only 42, why isn't that increased to 63 in the first place? If you're genuine, and they're saying it won't start till November, they're putting it off a long time, but why not increase the rebate to where it should be, at least $63? And then add the 12.5% if you bulk bill everyone, would seem a way of supporting Medicare. They're saying no, Medicare will only pay $42. This is just a incentive to bill at $42. So there's some, you've got to realise what they're doing there. So I guess what we're saying is we want more money into primary care. We want people to be able to be bulk billed to see a GP because it's much cheaper and cost effective to get them treated there earlier, to diagnose cancers earlier, to catch mental illness earlier. Very much more cost effective. We want a better funded community health so that people can be maintained properly in the community, and we want more salaried staff specialist fund, not just more VMOs, they're the key demands. Those demands unfortunately go federal and state. Federal's paying for Medicare and the VMOs, state's paying for the public hospitals and community health. And the political football goes on, and they try and shift costs to each other. Patients, their carers, and their GPs are caught in the middle. And at some stage, we need to stand up and call them out over this nonsense, because it is a nonsense. It is a nonsense. It's all coming down to cutting the budget, spending less money so that we can spend more money on other priorities, military, police, cyber, whatever. And that comes down to explaining to voters who they should be voting for, who's got the right priorities. So maybe I could leave it there and we can have a bit of a... I think I've outlined that it's all... Mental health is interrelated with GP, community health and hospitals. And health in itself is about prevention rather than just waiting to treat people at the crises when they get